Okay, so good evening, everyone. I'm MP Abubakar Babashehu, that is mental health professional. So I just came back from the field, but I have a terrible experience. Today, I lost one of my clients, patients through uh, suicide. He kills himself. So that's what stimulated me to make a kind of speech or create awareness on that particular suicide. So what we are saying, what we are referring to as suicide is self-murder. Self-murder for one to kill himself. That one we see is suicide. So there are a lot of factors that can provoke or precipitate one to have suicide. What are those factors? One, we have psychological factors. When we talk about psychological factors, like loss of loved one, loss of belongings, loss of properties, divorced, you know, uh, by communications, in a situation where you have double bind communications, two contrary statement. Maybe you say your father say go and do that, and your mother say no, don't go. So that particular situations can put one into, to have suicide. So then we have sociological factors. Under the sociological factors, the power of sociologist Duquesne look at it in three perspectives or three categories. One, we have egoistic. Egoistic individuals that have suicide or egoistic suicide is the one that doesn't socialize. People that isolate themselves, they have high risk of developing suicide or having suicide. Then we have altruistic altruistic. That kinds of people, this kind of people with suicide, people that have over socialized, because in mental health is two categories. We need one to be moderate, not hyper, not hypo. You need to be moderate. When you have hyper, you have mental illness. When you have hypo, also is mental illness. People that are over socialized, people that can sacrifice themselves for others, like soldiers in the field. Sometimes they can sacrifice themselves for the people. So these kinds of people are prone to develop suicide. That is altruistic. Then we have, according to sociologists, anomic suicides. So these anomic suicide, they are people that have change in social class, especially from the higher level to the lower levels. So such kinds of people are prone to develop suicide. Then we have biological factors. In the biological factors, something that happens within the body of an individual. Studies show that people that commit suicide, they have low level of uh, 5-hydroxy isoacetic acid metabolite in the cerebrospinal fluid. This is a metabolite that assists the utilizations or mobilizations. Yes, mobilizations that support the metabolizations of serotonin in the body. So when it is low in the cerebrospinal fluid, there is tendency for one to have this thing, suicide. So that is, then we have genetics. Suicide runs in the family. Genes plays role. So as that is why you can see we have a lot of suicidal cases in the community, but people do hide because of the way one commits suicide. They don't want their family to be addressed with someone that commits suicide. They say accidental deaths. They will be hiding, saying accidental death. That is why it is very difficult for us to have data suicide, suicidal tendencies. Then we have parasuicidal behaviors. Parasuicidal behaviors or factors, one that have or caught himself, injured himself, people with such, they are at high risk of having this thing, suicide. So that is so we then apart from that, in suicide, how can you identify people with suicide? There are some factors that we consider, that we look at suicidal ideation. Whenever you hear somebody is saying, this world is not, I'm tired of this world, such kinds of statement, I'm not interested in the world, of people hate me, all the people hate me. When you start hearing that, so this is a kind of notification that one will kill himself, is prone to commit suicide. Then people at low levels, low economic status, they are at risk of developing suicide. So the suicidal tendency, you know, the ideations that one having. So you need to be monitoring. Then apart from that, we have looking at the treatment of suicide. How can you look at the treatment? In the treatment of suicide, we have inpatient treatment and outpatients. In the inpatients, that is where the patients will be hospitalized in the hospital, neuro hospital, neuropsychiatric hospitals, or a ward, specialized wards for psychiatric patients will be treated using medications and other therapies. So then we have psychotherapy. This is why you look at, the cognitive status of an individual. You talk to him, bring him out of the fort. Then we have behavior therapy, cognitive therapy, counseling, you know, talking to an individual so that you may know what is going on. Then looking at the epidemiology or causes or outcomes of this suicide in the world, in the world, as a cause of death, suicide is about 10.5 for 100,000 individual or populations. Then Africa alone is 12.0 per 100,000, but Nigeria is 17.5. It's above that of the globe. And also, apart from that, in Nigeria, Bauchi State specifically, because we are in Bauchi State specifically, we have recorded so many cases of suicide. We have published one, we have unpublished. The unpublished is higher than that of the published. Yes, in Bauchi State. Like in 13th of September, this 2023, a 17-year-old patient, based on Bitrus in Bagoro local government, commit suicide. So also in March in 2021, Bello Husseini, on 18 February 2022, so that person in Ningi local government, he committed suicide. And there are a lot of attempt of suicide. That is the population one. We have unpublished, like the one we know, with the professionals, we know the one that is will be calling people attempted. But this one for the one that published, because the data on suicide is very difficult to get. So that is why they utilized the data from the hospital they got and the police stations. But suicide cases is far beyond that. WDCs, VDCs, all the traditional rulers, stakeholders have to be involved for this. All the hospitals, private hospitals, schools, because students are high risks, they have high risks of developing this suicide. We have a case of suicide at Abubakar Tafawa Balewa University here in Bauchi. We have a student that commits suicide, a student in technology education committed suicide. So people are at risk of having this. Bauchi, we need to have. But thank you with the President, His Excellency Wala Abdulkadir Auram Bauchi, which is the governor of Bauchi State. He is the first person to open mental health unit under the Primary Healthcare Development Agency. Since he's the one that opened, so now we have started and we are doing it, and we are getting results. Inshallah, we know the governor will do more beyond that under the leadership of Dr. Luan Muhammad, which yeah. So thank you very much. This is a short this thing on suicide.